There are people who don't have a lot of knowledge about skin conditions, and I do hope that through videos like this, they'd be able to understand more about what eczema is like, what living with eczema is like.
Hi everyone, I'm Dr. Kaycee Reyes. You can call me Doc Kaycee. I'm a skin doctor, preventive medicine practitioner, and founder of Luminisce. Our skinvestor for today was featured in our previous episode about dark underarm and hair removal. Now that she found a permanent solution to her armpits, she's now more happy and confident. Please see the link for more detailed information. Today, in this episode of Skinvesting, we invited her again. Cez has experienced eczema since she was a child. Repeated inflammation can cause scarring, and the quality of the scar is determined by the wound itself, inherited skin healing qualities, and how well this inflammation was treated, and the treatment that was used. All of these are attributed to our so-called childhood scar. This is just one of our interesting episodes, so don't forget to subscribe to our channel and hit the notification bell to see more of our content.
Hi everyone, it's me again, Cez Dimalanta, and today I will be sharing my Luminisce skinvesting journey on what it's like to have eczema and how we're going to treat it here at Luminisce. I've been living with eczema since I was around 10 years old, but then it wasn't this bad. Back then, I only had eczema patches on my arms and at the back of my knees. And then it would just appear for a week, reappear again after a few months, but that's it. It can be treated easily. However, since the pandemic began in 2020, I noticed that my eczema got worse. I started having itchy, flaky patches on my neck, on my armpits, on my legs as well, and the usual places. So it was really hard for me to treat it because there's just so much, and it can really be bothersome to have eczema. Also, I noticed that since 2020, my patches started to have a different color. Some of them became dark over time, probably because I can't help but scratch them whenever they're getting itchy. And then some parts are going super duper light, as in white levels, because of the steroids that I've been using for a long time. So that makes the eczema experience harder because instead of just treating the flaky, itchy patches, now I also have to make sure that I have even skin tone. Living with eczema can be challenging, and yes, it has already affected me both mentally and emotionally. There are a lot of times wherein I can't focus or concentrate on what I'm doing because the patches, the eczema patches, become so super duper itchy, I can't help but scratch them. I also stopped wearing sleeveless tops, shorts, or other revealing clothes because I don't want people to see the patches of eczema. There are times when people ask me what happened to my arms and legs, and it's just so hard to explain my situation to them because there are people who are very judgy. They usually assume that I already have a contagious skin disease, and it's actually very sad to hear those things, but we can't help it. There are people who don't have a lot of knowledge about skin conditions, and I do hope that through videos like this, they'd be able to understand more about what eczema is like, what living with eczema is like. Since I've basically lived with this my entire life, I've encountered a lot of triggers. So sometimes if I wear tight clothing, that would automatically lead to a flare-up. Whenever I'm stressed or anxious or when I'm overthinking especially, just a few hours after, sometimes I would notice my skin already itching. And then food as well can also affect eczema. Food can also cause flare-ups, and according to Dr. Kaycee and our doctors at Luminisce, I should also lessen my intake, or if not stop, just lessen it, my intake of milk, sugar, dairy, eggs. There are a lot of things that or food. There are a lot of food that I can't eat. So it's kind of hard to do that because all my favorites have these ingredients. The weather sometimes also affects my eczema. So whenever it's super hot outside and let's say I sweat a bit, it will already itch again. So there are a lot of triggers out there. Sometimes it would depend on the person. So it's really best to consult your dermatologist whenever you have flare-ups or when you start experiencing symptoms of eczema. As usual, I'm super duper excited about my treatment today. I can't wait to see the results because it's not only the eczema that will be treated today. We'll also be looking into the hypo and hyperpigmentation happening on my eczema patches. So both the dark and the super light spots will be treated today, and I can't wait to see holistic healing for myself. So fingers crossed, hoping for the best results.
Cez has a history of atopic dermatitis, which makes her skin more reactive to environmental insults and makes her more prone to scar and pigment formation. Atopic dermatitis or atopic eczema is a dry skin problem that stems from mutation of the profilagrin gene, which is responsible for the skin barrier function and protection of the skin. And with this mutation, there are higher chances of reacting to environmental factors such as heat, stress, and products. This makes the atopic skin more prone to scratching, skin infection, and changes of the skin color due to response to inflammation. Some rashes will develop pigments as a response to continued and repeated cycle of irritation, resulting to formation of post-inflammatory hyperpigmentation. However, some atopic patients respond by not producing pigments at all in the problem area, thus forming hypopigmented lesion, which we call post-inflammatory hypopigmentation. Complications of atopic dermatitis in skin of color. Number 1, post-inflammatory hyperpigmentation or the dark pigmentation. Second is post-inflammatory hypopigmentation, which is the loss of pigment and formation of leukoderma. For Cez, since her skin type is skin type 4, she is most likely to develop post-inflammatory hypopigmentation and hyperpigmentation. And this is very common among atopic dermatitis patients who have childhood scarring. Treatment for post-inflammatory hyperpigmentation. 1. Putting topical agents such as hydroquinone, topical retinoid, topical steroid, glycolic acid, and other fruit acids like azelaic acid and vitamin C. Second is resurfacing laser such as dermablade laser, baby skin laser, and picoablative laser. Third would be chemical peel such as coquille peel, citrine peel, and tressary peel. Hypopigmentation due to inflammatory skin disorders and infections usually resolves by itself over weeks to months and even years, once the underlying disorder has been cleared. In recent studies, hypopigmentation can affect the quality of life and self-esteem. Patients refused to leave their houses and felt socially inferior. As physicians, we aim to improve pigmentary changes but also improve the quality of life and self-esteem. There are a lot of convincing studies to prove that antioxidants and growth factors can help improve these cases, but patience is very important. For Cez, from the beginning, we know that it will take her at least 6 months to have the improvement on her legs, but Cez is diligent enough to come regularly to the clinic and do her, number 1, Ultra Revitale every 2 weeks. Second is application of superoxide dismutase, which is the only antioxidant enzyme that scavenges the superoxide anion by converting this free radical to oxygen and hydrogen peroxide. Therefore, adding this to her treatment can help recuperate her melanin production. Third treatment is topical immunomodulators such as calcineurin inhibitors. This is one of the best options during her flare-up, so she can avoid steroid for the meantime and prevent steroid-induced hypopigmentation because she has been using steroids all her life. Fourth is microtherapy plus growth factor plus hyaluronic acid plus neurotoxin, which is what we call Refresh Micro Cocktail. This special Luminisce concoction aims to help augment skin color by promoting healing mechanism of injured skin. PRP or platelet-rich plasma releases growth factors which causes healing and regeneration. It also promotes cell differentiation, proliferation, and regeneration, while hyaluronic acid induces remodeling of dermal ECM or the dermis and reduce inflammation, which is suitable for intradermal delivery. And lastly, neurotoxin or Botox has melanin protective property. Fifth, which is the most important, is putting the emollient moisturizer to the skin to rebuild her skin barrier function that can prevent flares.
Although today's treatments will not heal my eczema completely, I'm sure it was able to help alleviate the itchiness, the pain, and the flare-ups that I'm experiencing. And it gives me reassurance that I can live an entire week or weeks of my life without worrying about it, and that there is still hope for people like me who have intense eczema patches on their skin. But yeah, it's still important to always follow what your dermatologists tell you. Again, my name is Dimalanta and I'm a Luminisce skinvestor.
I hope you guys learned a little something from this episode of Skinvesting. Before you go, don't forget to like this video, subscribe to this channel, and hit the notification bell if you want to learn more from me and from Luminisce.